the tools are the tools that we use, and they may be very variable. We may use medication, we may use surgery, we may use herbs, we may use diet, we may use biofeedback, we may use even acupuncture, depending on what the problem is. We want to find the right solution for the problem. We're agnostic when it comes to the therapy. Right? We want to find whatever is the best thing for that particular problem. And that's really important to understand. And the way we interpret clinical data is going to change. So your minds are going to be open this week to a new way of interpreting the same data. So you may ask new questions, you may learn to gather some new data, but you'll still be looking at the same data that you learned in medical school. You'll just be reorganizing it into a different way of thinking about the consequences of seeing those patterns. You're going to be seeing new patterns. You're going to be seeing new representations of how things work. For example, when someone comes in to my office and they have a collection of symptoms like constipation and headaches and insomnia and muscle cramps and anxiety, my confusion about that is, well, which do I treat? What's the first problem I have to deal with? But when I hear that pattern of constipation and muscle cramps and headaches and irritability, anxiety, and palpitations, in functional medicine, I know that's a sign of magnesium deficiency. I had a woman come up to me the other day. She'd seen doctor after doctor, was having palpitations. Nothing helped her until someone gave her magnesium, because we began to recognize those patterns. We know scientifically that magnesium is involved in all those things, but we don't think about nutrition as being a first line of therapy. We also have to change our thinking from looking at pathology to looking at function, right? Pathology is very late. I don't know what textbook you use for studying pathology. In America, we use a book called Robbins and Cotran. In the first chapter of that book about the biology of the cell, it states very clearly that any pathological change is always preceded by a biochemical change, by a functional change. So if we can work earlier in the system and understand the functional biochemical changes before they become pathology, that's a good thing. So what we're looking at in functional medicine is not just focusing so much on the pathology or what you can see in a microscope, but what happens even before that. And again, we have to shift our thinking towards more etiology, thinking about causes. We want to become specialists in the causes of disease, not just in the pathology. We also want to be a specialist in understanding diagnosis by cause rather than by geography, right? By geography, I mean, where is the problem in the body? Is it in your head? Is it in your stomach? You know, in Chinese medicine, you can stick a needle in the foot and it can make your headache go away, right? That's something that's a strange idea, but it works. And you know in Chinese medicine that there's a connection in the body that links things together. That's a good thing, because you already have a big head start on the rest of doctors in the United States, because they don't understand that. So we don't want to just think about problems by where they are in the body, but by how they're integrated and connected. And we have to look at functional systems in the body, physiologic systems rather than diseases. Those are the things you're going to learn in the matrix. And we also want to focus on a new idea, which is that there's a continuum of function that is going all the way from perfect health through mild imbalances all the way to full-blown diagnosis and disease. And anywhere along that continuum, there may be problems. For example, we have artificial cutoffs for diabetes or hypertension, but what is the optimal level? Your blood pressure is 115/75, that's considered optimal blood pressure. But what if it's 120/80? Is that normal? Well, technically it's normal, but it might not be optimal. And it might be a clue that you might have some prediabetes. So what we want to do is be medical detectives. We're like the Sherlock Holmes of medicine. We're looking for clues and patterns and trails of problems that we can intervene with early, rather than waiting till it's a full-blown disease. Also, I'm going to share with you a little bit of some more clinical cases to help you understand how this works. Now, there are many definitions of functional medicine. They change all the time. This one probably is a few years old, and you'll hear a number of other ones that we've come up with. But essentially, it's a science-based model of personalized health care that assesses and treats the underlying causes of disease. And then we provide individually tailored therapies to restore health and improve function. And thereby disease goes away as a side effect. I don't often treat the diseases, I treat the system. And when I do that, disease goes away as a side effect. Our teacher and the founder of functional medicine, Jeffrey Bland, says functional medicine is a disruptive technology that will overthrow the tyranny of the diagnosis. We have to get away from this thinking of the diagnosis being the end of our thinking, but rather the beginning of our thinking. This has also been called P4 medicine, or medicine 2.0, which is personalized. We understand how to personalize care, because everybody's different. No two people are alike, and yet when we see people with depression, they all get the same treatment. When we see people with heart disease, they all get the same treatment. You can have 10 people with heart attack or 10 people with diabetes, and each one might have a different cause and a different reason, just like that patient with depression that I described. It's predictive. We can actually look at patterns based on health assessments and laboratory data and medical questionnaires and figure out where these people are headed and create a roadmap, a personalized roadmap for them to create health. And it's preventive. It's proactive rather than reactive. In medicine, we wait till someone comes to us with a disease instead of saying, how do we create health in this person? How do we shift our focus from illness to wellness, from disease treatment to enhancement of function? And it's also participatory. Rather than just saying, here, take this drug, we're asking our patients to make changes in their life, to change the way they eat, to change how they take care of themselves, to understand the principles of self-care. How do you maintain your health? You know, I remember being in Shanghai and the Bund and on the park on the river, and all these people were doing Tai Chi in the morning. It was beautiful to see hundreds of people out in the squares doing Tai Chi because they were practicing self-care. They understood that in order to stay healthy, they had to use their bodies and practice these ancient techniques of wellness. It's participatory. So rather than focus on the differential diagnosis, getting into a name of a disease and a pathology and using medication or surgery, we look at these matrix systems and we say, where are these systems out of balance? What are the causes of this imbalance? And then how do we promote balance? How do we get rid of the things that are causing a problem, and how do we provide those things that create balance? So let me tell you one more story to illustrate this about a little boy with ADD. Now, I'm sure this is an increasing problem in China. There's increasing autism, which is an increasing problems with cognition and attention deficit disorder. And there are many causes of this. But this little boy had been on Ritalin throughout his early schooling and had even had to repeat kindergarten. It's pretty bad when you have to repeat kindergarten. So he had many behavior problems. He couldn't focus, he was disruptive. He also had very bad handwriting, very bad, which is common in these kids, and they have motor problems. He also had a lot of other symptoms that most doctors would say are separate from his behavior problems. That his asthma and allergies and hives, his canker sores, his skin rashes, his postnasal drip, his sore throats, his bumps on his skin, those are inflammatory problems that aren't related to the dysfunction of his brain or his behavior. He also had digestive symptoms, right? Nausea and stomach aches, diarrhea. He had headaches, insomnia, muscle cramps, sensitive to noise. These are magnesium deficiency symptoms. He was also anxious, and he loved sugar. Now this boy was like this donkey. He had a system that was completely out of balance, and this imbalance was causing him to be sick. So rather than trying to just treat the symptoms with a medication like Ritalin, we needed a lot of different interventions to get in balance. We call this the 100 horses method. It's not just one thing. We have to deal with everything. You know, Sidney Baker was a teacher of ours who said, if you're standing on a tack, it takes a lot of aspirin to make it feel better, right? Take out the tack, treat the cause. But he said, if you're standing on two tacks, right? If you're standing on two tacks or nails, taking one of them out won't make you 50% better because you still have one in your foot. You have to find them all and remove them all at the same time. So this little boy had a history of antibiotics and frequent infections, and he was on 7 medications for allergies and hives, for asthma, headaches, many things. Lots of medications, had a horrible diet, junk food, processed meat, lots of sugar. And again, this was like mopping up the floor, treating all his symptoms. So the next steps, what did we do with him to diagnose and to treat him? Well, he had a team of doctors. He had a psychiatrist, he had a lung doctor, an allergist, neurologist, gastroenterologist, all treating him as if he had separate diseases. No one asked, How is everything connected? Their job was simply to match the pill to the ill, find the right medicine for his asthma, the right medicine for his allergies, the right medicine for his headaches, not to understand the root cause. And nobody said, gee, is this kid having just bad luck to have so many diseases at 12 years old? The problem was we're asking the wrong questions. So we took his history, went very early in the timeline. This is the other key tool you'll learn about this week. The timeline that helps you think about the progression of symptoms throughout someone's lifetime and how that links up to the matrix. And we connect this with the matrix, and we look at his story, and we found, looking at his system, we found a lot of nutritional deficiencies. We did testing. Now, not everybody needs extensive testing. A lot of times you can actually take a very good history and determine what's wrong and try interventions without having to do tests and have great success. But the tests are there to help you with difficult patients, or if the patients can afford it, it's a useful tool to use. But clearly he had low tryptophan, which indicated trouble sleeping and anxiety. He had very low levels of omega-3 fats, which affect his brain. He had high levels of arachidonic acid, which is an inflammatory fat, and trans fats, which are for processed food, and we know interfere with biology. He had zinc deficiency, magnesium deficiency, vitamin deficiencies, and he had B6 deficiency. He also had problems with defense and repair, lots of food allergies, antibodies to wheat, and an abnormal white count, which had high neutrophils and low lymphocytes, which can often indicate a yeast problem. And he had detoxification issues. He had high levels of lead. He also had, all these problems were related. So he had gut issues, he had inflammatory issues, he had toxic issues, and he had nutritional issues, and we had to address all these problems in an integrated way, which was not that difficult. And I use the matrix. I sometimes use the matrix that we have, or sometimes I just make my own, and I can just track what's happening to him very clearly and see these patterns. And when you write down all these problems using the matrix, which you'll learn how to do in the case studies, you're going to learn actually how to take the information from a history and from lab tests and put it in the matrix and have success. So what we did is very simple. We restored balance. We took away the bad stuff. I got rid of all the junk food in his diet, the sugar, got him off the food sensitivities he had, treated the yeast with an antifungal, and got the toxic metals out of his body with a chelating agent called DMSA. And then I put in the good stuff: nutrients, whole food, B6, magnesium, omega-3, zinc, vitamin D, and I gave him healthy gut bacteria, trying to restore normal function. I just took out the bad things, put in the good things. In 2 months, his symptoms were completely better. He was off all his medications. No more headaches, no more hives, no any problem at all, no behavior problems, no concentration problems, and he was sleeping. He also was succeeding for the first time in school and socially. He even resisted it when the children in school called him names and said he was an alien for not drinking soda. We did the lab testing again after a few months, and everything came back to normal because we got his body back in balance. But what was most impressive to me was this 2 slides here. This is a slide of his handwriting before. He's 12 years old. You can't even read it. It's impossible to read this as a 12-year-old boy. And without treating him with any occupational therapy or any other thing about learning how to write, we simply treated his body and got him functioning, and 2 months later, his handwriting looked like this. This is a remarkable change, and it means that the brain is affected by the body, and that if you create balance in the system, all sorts of problems will go away without treating them directly. So this is a big paradigm shift. And this paradigm shift is as big a shift in thinking as when Galileo said that the Earth is not the center of the universe. Right? That the sun is the center and the Earth revolves around the sun. Columbus also said the Earth is not flat, it's round. And yet in 1492 in Spain, people laughed at him because everybody said, look, the Earth is flat. You can stand on the tallest building, on the tallest mountain, and you can look out and the Earth is flat. If you go to the end, you're going to fall off. Right? And yet he was right, because sometimes the things we see that appear true are not true. And in the same way we think about disease, it seems real. Oh yes, this person has rheumatoid arthritis. This person has Parkinson's disease. This person has heart disease. Right? These are ideas we have. They're not really a representation of true reality. In the same way that Darwin said, the Earth, species don't show up just as they are. That, a rhinoceros or a cow show up that way. He says species evolve. This was a big idea, and we're still even questioning this idea, but this is the kind of shift that's happening in medicine today. The Earth is not flat, it's round in the same way. The way we think about diseases is really different. So how do we find our way if we're using the wrong map? We need to get out of this problem of naming that I said and follow this idea of Dr. Baker, which is to think about these systems and patterns that connect. Instead of the naming it, blaming it, and taming it game, which is where you name the disease, you blame the name for the problem. He has depression, that's what's causing the symptoms, and then you tame it with a drug. This is not the medicine of the future. We have the wrong map. It's not all these silos of specialties. It's really about the matrix. We've been changing our way of talking about disease to pre-diabetes, pre-hypertension, pre-dementia, pre-autoimmune disease. Or maybe these are just completely wrong ideas. Maybe there's a continuum of dysfunction, that we need to stop thinking this way and understand that we can treat things very early. And we have to, because as we've talked about, there's a huge burden of diseases that are chronic lifestyle diseases like obesity and cardiometabolic diseases, depression, neurologic diseases, allergic diseases, digestive diseases, migraines, autoimmune disease, and many other conditions. So the body is really like a network. So you could also say that functional medicine is like a network medicine or systems medicine. It's looking at the function of biological networks, right? This is a really important concept. Functional medicine is understanding that the body is made up of complex biological networks. And these networks are what's driving disease. And they're all connected. They're not separate. And so this is a very important idea. These patterns that we can find in the data are really key. So this is me 30 years ago. No, this is actually 20 years ago. And I was very sick, and I became very ill with chronic fatigue syndrome. In fact, it happened after I lived in China. And part of the reason, I think, was the pollution. Someone told me to get an air filter, which I did. I lived in the Lidu Fandian, and I had an apartment, and I cleaned out my air filter every day like I thought I should. So I took the air filter, it was full of black soot, and I'd take it out the window and I'd bang it. But I would breathe in all this concentrated pollution, and then my nose was all black, and I blew my nose after. I didn't know very much back then. And I got extremely high mercury levels. My entire system broke down, and through understanding my own dysfunction, I was able to understand more about functional medicine and how to create health. And that's when we began to form the Institute for Functional Medicine and really build our curriculum, build our training, and build our understanding of this model. And the people who you're hearing from in this room are the very people who've helped develop this model, who've helped create it and shape it from the very beginning. These are the leaders that you're hearing from. You may not have heard their names before, but these are pioneers in America who are bringing you these concepts, and I'm very happy that we can be here to share these ideas with you. So functional medicine provides this new model, this new matrix, like Zhujian, which is a new way of thinking about health. And it's based on some very key principles, some understanding very key fundamental physiology, and these core imbalances. So here's a little way of thinking about it, which is that there's certain key things that are driving all disease. And in medicine, we know there's like 15,000 diseases. The new classification system will have 55,000 diseases. This is going in the wrong direction. Because if we understand there's just a few basic causes, and we can chop them up in different ways, but it's basically environmental toxins or other toxins, allergens, microbes that are out of balance, poor nutrition, and stress. These are all interacting with our genes. These are the causes. These few 5 things are the real causes of almost all disease. And if you become an expert in understanding these things and how to diagnose them and treat them, then you can create health. And they influence our gene expression, and that changes these systems. Then we get imbalances in assimilation, in digestion, in defense and repair, our immune function, in energy, and how we make energy in our mitochondria, and how we detoxify and biotransform foods, and how our cells communicate and how we move things around our body, and also in our structural integrity from the cell membrane all the way to our biomechanical structure. And all these are embedded in our psychospiritual framework that determine our health. So this is a really important map for understanding how the body works. And again, we use a timeline, we use a matrix, which you'll hear about next from Christy Hughes. So when I apply this in my practice, I have to make it useful. I have to make it simple. Otherwise, I can't do it and treat patients. So we found that there's some few questions that you can ask that will help you to get to the answers. One is, what is causing the imbalance, and what do I need to stop the imbalance? We need to look at the basic ingredients for optimal function. So the functional medicine principles are pretty straightforward, that everybody's different, that where you have a unique gene expression, that it's focused on the patient rather than disease, that health is really about dynamic balance, and that everything's connected, like a web, and that health is not just the absence of illness, but it's about positive vitality and healthy life. And it's about enhancing, not just preventing symptoms, but actually how do you enhance organ reserve? How do you enhance your digestive function? How do you enhance your immune system? How do you enhance your detoxification system? These are all important questions. So again, the matrix you'll learn about, I'm going to let Christy talk about that, but these are the areas of the matrix that we focus on. And then the two questions are pretty straightforward. One is, what is it that this person might need to be rid of to create health? Is there something bothering them? Is there something creating imbalance? Is it something toxic, allergic? Is it a microbe? Is it poor diet or stress? And does this person have some unmet need that's unique to them for something that's going to create optimal function? Is it more sleep? We know, for example, that sleep deprivation impairs cognitive function, causes diabetes, causes appetite dysregulation. It creates all sorts of increases in stress hormones that are probably going through me now because I got in late last night and I had jet lag and I'm craving sugar because I didn't have enough sleep. So I know this is happening to me because of something I have an unmet need for, which is more sleep. So the causes of disease, again, are these basic things: the toxins, allergens, microbes, stress, poor diet. And then what are the things that we need to get rid of? So when you say, these are the things we need to get rid of, these are the things you need to become an expert in. And you will learn this over the course of this week. And what are the ingredients for optimal function? There's a very simple list. It's not complicated, right? We are human beings, we're biological organisms, and we require a few basic things to thrive. What is it that we need to thrive, right? We need the right food. We need the right quality of food. I have a new word I've been using. It's called a qualitarian, meaning we should be focused on the quality of our diet and the quality of the food we put in our bodies because it determines most of our health. Eating 240 calories of soda, Coca-Cola, 120-ounce soda, with 15 teaspoons of sugar, right, is a carbohydrate, it's calories. It's very different than 240 calories of broccoli, which has only half a teaspoon of sugar and 35 grams of fiber and doesn't cause all the same negative biological effects. Instead, the soda with the same amount of calories will cause disease, while the broccoli, which is also predominantly carbohydrate, will prevent disease and improve detoxification, provide nutrients that you need, extra fiber, improve your gut flora, as opposed to create diabetes and insulin resistance. Same calories, very different effect. You're going to learn here that food is not just calories, it's information. This is exactly what I mean. You also may need specific levels of nutrients. A gentleman came to see me the other day who was having memory problems, and he had a genetic problem called MTHFR, which is a folate gene, regulating gene, and he was having early dementia and memory problems. So I gave him extra doses of folate and B12, and his memory came back. He was able to function quite differently with a very simple intervention that was needed for him. We also need light, and light plays a huge role in our health. The rhythm of light, the daily circadian rhythms, the way it affects our pineal gland, our hormonal production, our health, vitamin D, etc. Water, we need clean water. Jim Kim, who's the head of the World Bank, said that in the future, the wars in this world will be fought over water. We're seeing decreasing stores of fresh water. But we need clean water. We need clean air and air. We need movement. Our bodies require movement. We need rhythm. Rhythms of waking and sleeping and eating and moving every day in a way that allows our biological rhythms to thrive. And we also need love and community and connection. These are really important. These are not just platitudes. These are not just a nice thing to say, right? We found that in animal studies, if you take a monkey and you put him in an isolation room, feed him exactly the same diet, and compared to a monkey that's put with his mother and other monkeys, the monkey that's alone will not thrive. They'll look much older. They'll have disease, even though they have the same diet and lifestyle, basically. So we need connection and community and love. And I think this is the biggest ingredient for health and behavior change for most of us. We also need meaning and purpose. We need to feel like we're part of something, that our lives mean something, and it also plays a huge role in health. So the way we treat patients then becomes very different. It's a very different encounter from the differential diagnosis, which is the old model, a reductionistic model, to the new model, which is understanding that we need to focus on medicine by causes, by etiology, right? By looking at patterns that connect everything together. And by the end of this week, you're going to begin to understand some of those patterns. You're going to be able to take a history from your patient at the end of this week and see things and connections that you never even imagined existed, and be able to try things and have them be successful, even if you don't really understand it that much yet. Because when you work this way, you see extraordinary changes. Rather than in medicine we eliminate confounding variables, we want to include everything. When you go to the doctor and you say, you go to the doctor and say, well, I have some chest pain. They want to know all about your chest pain. Where is it? Does it radiate? What happens? Is it with exercise? Do you get shortness of breath? Are you sweating? These are the questions they want to know. But if you say, I got chest pain, but I also have this rash on my leg, and my knee hurts, and I get headaches, they're going to go, wait, you go see the neurologist for your headaches, go see the rheumatologist for your joint pain, go see the dermatologist for your rash. In functional medicine, we say, no. I want to know about everything. I want to know about all the symptoms, because there are things connecting those together that are going to give me the clue to why you have the chest pain, to why you are sick. It's a very different way of thinking. So rather than naming and blaming, say you have this disease, and then we're going to blame the name for the disease, we say, no, this is a different way of thinking through the matrix, through these new lenses, and organizing the data differently. Rather than just using a confirmatory lab test to show an on or off thing, you have a blood sugar of 120, you're normal, 126, you're diabetes, it doesn't make sense. We're looking at testing in a different way. We're looking at functional testing, at dynamic testing, at looking at patterns and imbalances. We're not looking for pathology so much as dysfunction. And rather than just treating symptoms and suppressing symptoms with drugs, which, listen, I'm all for suppressing symptoms. If someone's suffering, we should try to help them and relieve suffering. That's our role as a doctor. But we also, at the same time, we want to remove the cause. We want to learn how to restore normal function. So let me tell you one last story, and then I'll let Christy tell you more about the matrix. You might feel like you go back to work after this course, and you might feel like this guy, Yuri Gagarin, who was the first man to fly in space. He was sitting on the top of a rocket ship, and he'd never done this before, and no one had ever done it, and who knew it was going to work, but he was brave and he tried it. You might be like him, and you can try it, because we actually have spent a lot of time organizing this data in a way that actually allows you to put it in practice and make it work. There is enough information today to solve any problem. We just have to put it in the right order, and functional medicine is going to help you put it in the right order. So this is a patient, call her a holistic patient, because she has a whole list of problems. She had 29 different diagnoses, 29 different diseases that were all treated differently. This is insanity, right? We do a medical symptom questionnaire, which is something you'll get in your toolkit, which asks a bunch of questions like a review of symptoms, and you get a score on how sick you are. If you're over 100, people are usually in bed. She was very overweight, she had a BMI of 37, and she was heavy. And she had many, many problems: irritable bowel, hypertension, low blood sugar, metabolic syndrome, low thyroid. She had PCOS, she had infertility, she had weight issues, she was bulimic, anorexic, binge eater, she had kidney stones, gout, yeast infections, she had allergies, asthma, sinus problems, sleep apnea, psoriasis, depression, anxiety, arthritis, pretty much everything she had it, migraines, headaches. What do you do with a patient like this? You think they're crazy, and you send them to the psychiatrist, you give them an antidepressant, or do you try to think about how these things might be connected? So we used the map of functional medicine. We looked at her communication. We looked at how her hormones Her neurotransmitters were working. We saw she was insulin resistant. She had PCOS, thyroid problems. She had heavy periods, so we knew she was estrogen toxic. She also had PMS, so we knew there was an imbalance in her hormones for some reason. She had fibroids, which indicate excess estrogen, and she had mood problems. She also had a lot of inflammatory issues, and often inflammation is the root of a lot of these neurologic and hormonal issues. Inflammation is often the root cause of most of what we see in functional medicine. So she had food allergies. I guess that she had a gluten problem because it's one of those things that connect all these things together, like her thyroid and her osteoporosis and her digestive issues. These are all common things that can be caused by gluten. She had rosacea and asthma and psoriasis, also connected to gluten, as well as swelling. And digestive issues, irritable bowel. This is her assimilation system. Bloating and bacterial overgrowth, which we'll learn about, and reflux. And she had signs of being toxic. She had fibromyalgia and mercury toxicity, and had mercury in her teeth as well. And nutritional deficiencies. She lived in northern Canada and had vitamin D deficiency, and a lot of her irritability, anxiety, muscle cramps and things were caused by magnesium. So what did we do? We started with her digestive system, and you learn in functional medicine that we often start in the gut. The gut is the seat of your health. And if you have a healthy gut, a lot of other things work well. And we're learning more and more about the gut. And in fact, we're learning about this amazing creature called the microbiome that has more cells than your human body, has 10 times as many cells, that has 100 times more DNA than your own DNA, and it's a very dynamic system. And when that's out of balance, it creates disease. So we got her off the foods she was allergic to. We treated her bacterial overgrowth with medication and her yeast overgrowth. We gave her enzymes and probiotics to help put back healthy bacteria and get her digestion working. We gave her an anti-inflammatory medical food that helped her body to heal in the gut. I gave her a thyroid hormone replacement because based on her history, I thought she was hypothyroid. And I gave her some basic nutrients to help her estrogen metabolism and some extra fiber that comes from konjac, which is the Japanese root, that helps to reduce blood sugar problems. And I also gave her some basic nutrients, a multivitamin, fish oil, chromium, and so forth, and vitamin D. And when I did that, I did all of this just based on her history, right? And then I did some laboratory tests. And when I got the laboratory tests at 6 weeks, it was clear she had elevated antibodies to gluten, which no one had diagnosed. So she had sort of borderline celiac disease. She had autoimmunity, because it was causing inflammation, and she had autoimmune thyroid disease, Hashimoto's, never diagnosed. Her basic thyroid test was normal. Her TSH was normal. Her free T3 and T4 were basically normal, but I still felt, based on her Hashimoto's, that she should be treated. She also had evidence of blood sugar problems and insulin problems,